Hey folks, how are you doing? Thank you so much for tuning in. I appreciate it every time tuning into this channel, and I am so grateful for paying attention and connecting every time. So today we are going to be talking about positive mental health. We'll be talking about it, but there are some factors, there are certain characteristics, attributes that is essential, important for us to learn about mental health in its entirety. And um, if you've been on this channel or you are just coming in, meeting me for the first time, my name is Dr. Debbie. I'm a psychiatric nurse, doctoral practitioner in the United States. I'm board certified and licensed in the state of New York and Maryland in the United States, where I see patients, I review, assess, evaluate, and make diagnosis about mental health and write medications, prescription, and just to support and make sure that my patients are enjoying the best of their life and getting all the help that they need. And on this platform is to bring literacy and education about mental health to all. So we dive into it, and in a simple term, the definition of mental health is can be defined as a state of physical, social, psychological, and spiritual well-being of an individual that enables him to cope, such individual to cope with the recurrent stresses of living, and also the individual is able to adjust effectively within a given society. Mental health is closely related to physical health as the body is unified and integrated as whole. What affects the body automatically affects the mind. As I always say, that the most vital organ that makes us human is our brain, that it supervises, it controls the entire other organs, other essential organs of the body. And because of that, both are unified together, both the physical health and the mental health. So, if we may say or ask, what are the characteristics of mentally healthy individuals? A mentally healthy individual has a positive attitude to life. Most of the time, the person could get on reasonable well with self and enjoy a healthy relationship. One should be even tempered, alert, and efficient. Also, should be able to work and play peacefully with others with minimal sense of fear and insecurity. And also, such individuals should be able to exercise a great deal of self-control and be very much adaptable to necessary changes without conflict. So those are when we see such characteristics, attributes. There is no one one factor, one peg fit all. Yeah, so but most of these boxes, mentally healthy individuals should be able to check those boxes, that they are able to adapt to their environment, they are able to be at peace with themselves, with peers, in relationship, and those are the attributes of mentally healthy individual. And then if you want to ask what are the factors that can influence mental health, yeah, like from studies and researches, there are a lot of factors that can influence people's ability to cope with life. Probably maybe when we talk about life philosophy, it's just their own way of life, their own way of belief, philosophy, and that helps them to cope and adapt with stresses of life and be able to maintain a positive mental health. Some others is from the religious point, that because of their religious practice, their faith, their conviction, it's able to guide them on their attitude, on their attributes, on how they view their world view and their relationship with others, and they're able to cope with life, with work, with relationship, and they are able to maintain positive mental health. So faith tends to bring up hope in an individual, and situations becomes better and tolerated. Yeah, and instead of worries, one takes solace in what that individual believe. So like people that have such strong religious beliefs or background, they do not suffer so much from severe anxiety, depression and all that. And even when maybe due to genetics, because there are a lot of factors that contribute to mental disorder, they don't get to the extreme, and especially the risk aspect, because their religion is one of the positive like supports. Yeah, when people, their religious faith, that, oh no, I cannot hurt myself, because my religion does not permit that. Also education, yeah, like that's a very strong influence on mental health, through education and interest, like interest in literature, interest in music, art, or natural history. It provide an outlet for leisure time, for hobbies, for interest. So education generally prepares an individual to be a good citizen, and also help to develop the intellectual capacity to the fullest. And with this, in most, there's always an outlier. It's not always 100% of the time, but most of the time, like education in what we have mentioned, is able to help people, to have a positive mental health. And mental illness is, as we said, like we said, it's not 100% of the time that when people check all these boxes, because there are a lot of factors, that can predispose or are risk factors to developing mental disorder. And mental illness, as we said, is usually caused by numerous factors. It's multifactorial, and these factors can be due to maybe predisposing factor, probably genetic, maybe environment and relationship, or like toxic work environment, and also precipitating in nature. When people are overwhelmed with stress, it can precipitate or predisposed to mental health disorder. So let's look at like predisposing factors. I've mentioned earlier, like genetic factors. So there are certain genes or specific, gene carry traits of mental illness, according to studies, or genealogical studies, even among twins, that genes can make people to be predisposed or responsible for some biochemical anomalies, which are noticed in some disorders, especially like depression. A lot of people, during our evaluation and assessment, they report, presence of family mental health disorder, maybe mom side, dad side have depression, or grandparents, and the same as well with schizophrenia, and as well as bipolar. So those are genetic predisposition. And also due to chromosomal abnormality, inappropriate cell division in embryonic stage can lead to monosomy or trisomy, like, which may cause syndromes such as Turner syndrome. That's Down syndrome. As we see, it is still under the classification of psychiatry. And constitutional factors such as people's physique, their body, their figure, and all that, like, is in studies, is also related to mental disorder. Like maybe like people that are tall, they are slender, they are thin, they are prone to schizophrenia, anxiety, agitation, depression. And people that are muscular, they are not thin or fat, but they have broad shoulders, can develop any kind of disorder. And people that are short, they are stout, can develop manic depressive illness in those classification. And then when we talk about personality as well, as part of factors to be considered in mental health disorder, because our personality is the sum total of a person as an individual. This our personality include, like our physique, our temperament, our behavior. And we have different type of personality. There are some that we refer, like epileptic personality. They are stubborn, they are rigid, they are dramatic in nature. And then like now those are like antisocial personality, like many of them, avoidance, many are narcissistic, and borderline personality, and or attention seeking personality. And then we have schizoid personality. They are shy, they are secretive, they are self-centered, they're introverted, and those most of the time they end up like illnesses like schizophrenia. And we have people that are, like some personality, they are the life of the party, and those tend to develop mental illnesses like mania, hypomania, cyclotamic mood swing, and they can highly be unpredictable. Among the predisposing factor as well is the age. So there is age factor, the two extremes of life, like maybe the very young and the very old. They are very much prone to psychological stresses. In childhood, individual defenses may be inadequate for children, and I specialize in mental health care, to children, to young ones from age 6. And there are some other people, like we want like pediatricians to see people that are below that age, maybe from age 2, 3, 4, 5. But we still want to give them, some time for them to develop mentally their nervous system, and then by 6, we are able to establish a concrete diagnosis and be able to help and support. Also in old age, degenerative changes predisposes people to break down. And in middle age, one is faced with numerous problems like marriage, jobs, achieving ambitions in life. All these, people have like resilience, like coping mechanism that help them to face all those problems and challenges of life, and they are able to adjust to situation in life and be able to scale through without breaking down until later in adulthood, when all these problems will start, to disturb and make the individual to break down mentally. And also another factor is due to gender, due to gender, women are more vulnerable than men due to changes in internal environment and at puberty, at childbirth and menopause, the hormonal changes and fluctuating at different phases of life, for the feminine people, for the women, for the female gender, try to be very fluid, volatile changes, like during puberty, during childbirth, during pregnancy, during menopause, and this at all those individual phases of life make them to be highly predisposed to mental health disorder due to whatsoever is going on in their life, in their family, in their environment, in their relationship. And so after talking about predisposing factor, we can bring it down to precipitating factor, which are mainly environmental, like maybe physical due to brain injury, fall from height, road traffic accidents, birth injuries like prolonged labor, difficult childbirth, and difficult labor. The child is not able to get out of the birth canal quickly, or even when they get out, they've already been distressed, and they are not able to respond immediately to resuscitation or delaying starting their own independent breathing. So, and they also, like, in some places, maybe like people that due to healthcare access, or maybe negligent, or some situations, even where, like in America here, I've seen some patients, that they didn't even know that they were in labor until the baby is almost out, and people deliver in transit, to hospitals, and all that will have impact on the brain of those children, and all the stress and all that the baby will be in distress can cause that. And also like complications, to babies at birth. Like I've said, due to prolonged labor, baby not receiving immediate birth resuscitation, and then neonatal complications. And also about infection, there are lots of infection, like in some regions, like in the tropical, having typhoid fever, if it is not well treated, can lead to psychosis. Like even malaria, it is common as well in tropical area, can lead to cerebral malaria. And meningitis, which is a bacteria viral infection, like encephalitis. This infection of the brain, especially common in children, or if they are not properly immunized, or maybe before the age that they are due for those immunization, can lead later in life, because of all those insults or injuries to the brain, and some infections in pregnancy like rubella, German measles, or even yes, to pregnant women. And even here too in Western region, there are certain infections like some viruses, if pregnant women are exposed to them, can impact those children when they are born. And as well, there are certain things also like in society, where smoking, illicit drugs and alcohol use during pregnancy can affect the development of the brain of those babies while they are during pregnancy. If the mom is a smoker, if the mom is consumes alcohol or some other chemicals being introduced during pregnancy, can impact the development of that child. And it depends on the extent that we determine the severity of mental health disorder that baby is going to struggle with later in life. And as we have talked about elderly people, like degenerative changes, old age, dementia, Alzheimer's diseases, and some other electrolyte and chemical imbalances in elderly people can make them to be predisposed, to certain mental health disorder in old age. And intoxication, like some poisons, lead, like I've talked about, drug, cocaine, heroin, if the mom engages in such, or maybe in houses that are old, like in Western region, you see houses that are 100, over 100, close to 100. Those are predisposed to lead that could cause brain toxins to the developing baby. And as well, nutritional deficiency, especially in this stage, that kids, they like the refined food, they like all this junk, fast food, they are not eating healthy. It can impact, because we get all the chemicals, the brain chemicals for our brain health from food, from vegetable, from plants, from protein. And if they are not consuming all this adequately, can impact the development of their brain. And all those deficiencies can lead to malnutrition, or vitamin deficiency can lead to impact in the development of the brain. And also, when people develop tumor, neoplasm of the brain, it will definitely impact the functionality of the brain structures and brain chemicals. And there are lots of other vascular diseases like ischemia, transit ischemia diseases, like in hypertension, people have cerebral vascular accident, stroke. Is going to impact a lot about the functionality of the brain. And systemic disorder like endocrine abnormality, I've always said the brain is the most important organ because it oversees all the other vital organs. So all these other organs too, like I said, the brain and the mental health and the physical mind and body, they are together. When even other systems are having problem, it's also in most times affects the brain. So like abnormalities with the endocrine system, with thyrotoxicosis, that provide like some hormone, thyroid hormone, for our metabolism and other functioning of the brain, like diabetes mellitus, or it can lead to diabetes encephalopathy, which impacts the brain. So all this as well can precipitate mental health. And also, even in some conditions like complex of HIV, or in the terminal phase of HIV, also can trigger, or like sexually transmitted diseases like syphilis at the latter stage can also precipitate mental illness. So mental illness is very broad and wide, and it is important that we just take care of ourselves, for our well-being, for our overall wellness. And when we talk about psychological factors that can impact mental illness, like because of the society, the world is evolving, and there's a lot of us, we are developing, we are growing, population increase, there's increased stress and we have the resources is limited, within the increasing number of people available, and that generates stress and anxiety, and it could affect us as human, like in some region, like they struggle with resources, leading to poverty, malnutrition, crime, diseases, and all that. And where there's all this poverty, malnutrition, it always go hand in hand with crime and diseases, which it definitely will impact positive mental health. Like poverty is associated like with social deprivation, overcrowding, parental neglect, because parents, they have to go and source for the welfare of the kids. They are working all day, no time to take care and direct the kids, and this exposes the children to a lot of other negative impact. And with that, a lot of people to self-medicate because of the high stress they are going through. They get into drug addiction, into alcoholism, and this also environmental made personality disorder because of exposure to negative influence in the society. And also, as I've said, unusual experiences in childhood which bring about emotional maladjustment later in life, like parental intimate partner violence, parental friction, prolonged separation and divorce, neglect or rejection from parent of children. And at times, because the parents are inconsistency, in their parental role, this could lead to a deficit in child training, and all this, pieces come to a whole later in life, precipitating mental illness and psychological stresses. Like for young folks, academic stress, too much rigor with the course of profession they are pursuing, how academics can be, to be on top. For you to be able to get good education, it takes a lot of hard work, burning the midnight oil. And vocational stress is also, overstretching physically and not enough time to rest. And as well, financial stress, unemployment, lack of job, inflation, not enough money, for people to get on in life, and marital stresses, like people not understanding each other, and infertility problems as well. Following marriage could be a source of stress and marital conflict. And as well, when in old age, people feeling of uselessness, they think they are not useful again for anything, could bring a kind of mental health concerns later in life. And at times there's unrealistic expectations. When people set high unrealistic expectations, could lead to anxiety and depression. And unexpected situations like disappointment in business, disappointment in relationship, disasters, natural disasters, fire incident, robbery, attack, and every kind of disasters could really impact people. And of course, loss of anything, loss of loved ones, loss of property, loss of job, loss of sight, loss of health itself, and loss of even the mental health, the mental soundness. All this could impact mental health. So how do we prevent mental illness with all these factors that we have mentioned? Primary level that is important, as we are hearing all this, and that's the essence of this education and literacy, to know how to not drive yourself into high stress, to just plan, organize, and just make provision for yourself, and live healthy, and try your best to be the best version of yourself. And of course, like this, we are bringing the education to the public for people to know, and through different means, social media and print media, and every kind of avenue, platform that we can raise the awareness that all this they bring negative impact on our family, on our mental health. And as well, like we make use of the resources, like provided by the government, medical access, healthcare, and also career counseling, for students. Like, yeah, in the West, you have your advisors, reach out to them and make sure that, they're able to access and see your capability with the choice of your course. And it is important as well, genetic counseling, since we said that mental health is present, genetically in some families. It's important that people go through genetic counseling before they get married to prevent having, like, the pattern in the family that will bring stress later. And the aspect of the government doing their part, improving, helping people to improve the quality of life, provision of employment, job opportunities, the recreational facilities where people can go to let out for whatever, through the means that will be their hobbies, their interests, good healthcare delivery system, power supply, housing, and ways to reduce accidents, like good to make people to be compliant with the road system policies, rules, and regulations, and as well as security of the people, of life and property, to reduce robbery, attack, assault, gun violence, and just for people to feel safe and enjoy positive mental health. And the secondary prevention is on referral system, that to people to remove the negative aspect, that mental illness, it can be anyone, and we have listed all areas that mental illness will occur, and people should remove the stigma, the negative criticism or shaming people, and so that people can come forward to seek help, and that we help them to get the help that they need. And the tertiary is by the government, provision of adequate healthcare system where people can go for outpatient, telehealth, in person, and people can regularly get the help that they need. And and we're going to be considering a lot of one by one different list of mental illness, as in this series. Like we talk about those that are relating to children in infancy, like mental retardation, learning disorders, motor skill disorders, communication disorders, and all the developmental disorders, ADHD, attention deficit and disruptive behavior disorder, and hyperactivity in children, eating disorder, tic disorder. And we're going to, and for the elderly, about those mental health problems that is peculiar to the older people, like dementia, Alzheimer, and those that are related to substance use and alcohol use disorder. And in my practice, I attend to people with addiction, with alcohol, just from age 6 to adulthood, teen, children. I see all of them, just to give people the support and the health that they need, because I believe that mental illness should not stop anyone from achieving their potentials. And of course, the schizophrenia, bipolar, and then the mood disorder, which is depression, and bipolar and anxiety disorder. And I hope you learned something in this educative, this literacy, just to familiarize people and the society with different aspects of predisposing, precipitating factor, how to maintain a positive mental health. And I hope you learn something from this talk, and then you will like it, you will share, you will comment, and I will always respond to your questions, to your clarifications. And thank you so much for your attention, and until I come your way again, it's me, your mental clinician, Dr. Debbie, and have a good one. Bye.